Welcome to the National Press Theatre pour cette conférence de presse avec des ministres et des représentants de l'Agence de la santé publique. Donc, à partir de ma droite, il y a le ministre des Affaires étrangères, François-Philippe Champagne, le ministre de la Santé, Mme Haidu, the Defense Minister, Harjit Sajjan, and then two officials from l'Agence de la santé publique, la Dr. Teresa Tam, qui est l'administratrice en chef, et son bras droit, le sous-administrateur en chef, Howard New. Ils vont avoir des déclarations. They will have quick statements, and then we can go to questions. We have also people on the lines waiting for a question, and after the declaration, we'll do the little rules for the question. Merci, M. Champagne.
Merci. Alors, bienvenue tout le monde. Merci d'être là. Au cours des derniers jours, nous avons travaillé sans relâche avec nos fonctionnaires pour aider les Canadiens qui souhaitent quitter la région de Chine, présentement en quarantaine. Comme vous l'avez vu hier, nous avons un avion déjà affrété qui se rendra à Hanoï, au Vietnam, où il sera prêt à partir en attendant les approbations finales des autorités chinoises. L'espace aérien de Wuhan étant fermé, nous avons donc besoin d'une autorisation spéciale afin que notre avion puisse atterrir. De plus, nous avons besoin que le gouvernement chinois approuve le manifeste de vol et tous les documents des Canadiens qui souhaitent partir pour qu'ils puissent se rendre à l'aéroport qui est aussi actuellement fermé. Nous allons prendre contact avec les Canadiens à Wuhan plus tard dans l'après-midi pour leur fournir tous les détails nécessaires. En ce moment, nous avons des membres de l'équipe permanente de déploiement rapide qui sont déjà sur le terrain à Wuhan et à Hanoï pour aider la coordination. Les autorités chinoises et vietnamiennes coopèrent avec nous et nous les remercions. Toutefois, il faut comprendre qu'il s'agit d'un processus en plusieurs étapes, étant donné la complexité de cette situation en évolution constante. Nous avons maintenant tous les visas nécessaires pour l'équipe permanente de déploiement rapide, l'équipe médicale du ministère de la Défense et, évidemment, les équipages de vol. De plus, comme la ministre Haidu a mentionné précédemment, nous devons également tenir compte de la santé et la sécurité des Canadiens ici, ce qui nécessitait évidemment une analyse approfondie et des décisions concernant la mise en quarantaine des Canadiens qui reviennent au pays. Je veux que tous les Canadiens actuellement à Wuhan, ainsi que leurs familles et leurs proches en dehors de la région, sachent que nous faisons tout ce qui est en notre pouvoir pour les aider et qu'ils peuvent contacter nos agents consulaires pour plus de détails. Je vais maintenant faire la même déclaration en anglais. Thank you, everyone, for being with us here today. Over the last number of days, we have been working around the clock with our officials to assist those Canadians wishing to leave the region of China currently under quarantine. As you saw yesterday, we have chartered a plane which will be going to Hanoi, where it will be pre-positioned as we await final approvals from the Chinese authorities. The airspace in Wuhan is currently closed, so we need special dispensation for a plane to land. Furthermore, we need Chinese approval for the flight manifest and all the documentation of Canadians wishing to leave in order for them to travel to the airport, which, as you know, is currently closed. We will be in touch with Canadians in Wuhan later this afternoon to provide them all the necessary details. We have members of the Standing Rapid Deployment Team now on the ground in both Wuhan and Hanoi to help coordinate all this. The Chinese and Vietnamese authorities are cooperating with us, and I want to formally thank them. But it is a multi-step process given the complexity of this evolving situation. We now have all required visas for the Standing Rapid Deployment Team, the DND medical team, and the flight crews. Additionally, as Minister Haidu mentioned, we also need to consider the health and safety of Canadians here at home, which required analysis and decisions regarding quarantine for Canadians who are leaving. I want all Canadians currently in Wuhan and their family and loved ones outside of the region to know that we are doing all we can to help them and to be in touch with our consular officials for further details. I'll now ask Minister Hajdu.
Well, thank you very much, Minister Champagne. So as the Minister has said, this is a number of government agencies that are working very closely together, and we're also coordinating with provinces and territories, in particular Ontario, obviously where Trenton is based, but I want to thank Minister Elliott and her team for ensuring that we have such close collaboration with the province of Ontario. I also like to thank all of the other provincial and municipal health authorities who are in constant collaboration in terms of managing coronavirus here domestically, but who will also be assisting us in a number of ways throughout the repatriation process. So we've developed a plan really with the goal that the Minister has indicated, which is to protect the health and safety of Canadians here in Canada, but also to protect the health and safety of Canadians who are unfortunately trapped in Wuhan in particular and have no other way to get home. So here is what the process will look like. In terms of the pre-boarding process in China, all Canadians who will be boarding the flight will undergo medical exit screenings by Chinese authorities before being allowed in the airport. And then travelers will undergo a second screening by Canadian Forces medical staff before being allowed to board the plane. During the flight, Canadian Forces medical team will complete a detailed health questionnaire to gather traveler contact tracing information. And if a passenger becomes ill during the flight, they will be moved to and segregated in an isolated area of the plane and masked for the duration of the flight. The plane will stop for refueling in Vancouver, and I'd like to thank the government of British Columbia for their support in this. Passengers will stay on the plane while the plane is being refueled. If a passenger is ill and exhibiting symptoms on the flight, they will meet immediate medical assistance from the province of BC, who will transport them to a facility, and they will be isolated to prevent spread of disease, but also to protect them and to help them recover. The arrival point will be CFB Trenton, and the CFB Trenton area was chosen because it's an area that we can support coordinated and contained processing and support services. It also has a facility available to house people in a very dignified manner. I want to remind people that these are Canadians who have been through a very traumatic experience over the past couple of months, and in many cases will have significant stressors. They will be processed automatically by CBSA to secondary screening based on having, oh sorry, I've skipped a step here. In the event that a passenger becomes ill on the flight from Vancouver, emergency medical staff will transfer that ill passenger directly to local healthcare facility in Ontario for examination, isolation, and treatment consistent with the approach determined by the Ontario Public Health Authority. And then upon arrival, all travelers will be automatically processed by CBSA to secondary screening based on having arrived from the Hubei province. A high level of health assessment, visual temperature check will be done to determine if anyone is visibly sick from the passengers debarking. And then under the authority of an emergency order pursuant to the Federal Quarantine Act, all passengers will remain at CFB Trenton for 14 days after arrival to allow for a full health assessment, follow-up observation by public health officials, and support services as needed depending on their circumstances. During the 14 days, we'll offer social support as well as mental health services given the stressful experiences that many of these passengers will undergo or have undergone. We may consider additional testing as part of the health assessment protocols in consultation with provincial public health authorities. And should symptoms be identified at any time, the traveler would be appropriately transported in coordination with the provincial health authorities to a local hospital for further treatment, isolation, and contact tracing. Onward travel information of asymptomatic Canadians returning on the repatriation flight will be communicated to their respective provinces and territories to facilitate any further follow-ups that may be required by local public health authorities. And following the completion of the full health assessment, the Government of Canada will provide transportation to Toronto, Ottawa, and Montreal for passengers. I will also say that all crew will be wearing protective gear so that they also can be protected and quickly deployed. And today we are actually undergoing a dry run at CFB Trenton to make sure that our processes are in place. And now I'll turn to Minister Sajjan, who will share a few words from the defense involvement perspective.
Great, thank you, Mr. Haidu. The Department of National Defense and the Canadian Armed Forces will always be there to help Canadians in time of need. And as you know, just last month, troops were deployed to Newfoundland to help the residents after a major winter storm caused a state of emergency. And at the request of Minister Champagne and Minister Haidu, I've authorized the Canadian Armed Forces to support the returning Canadians currently impacted by the recent quarantine measures in Wuhan, China. Under Operation Globe, 6 Canadian Armed Forces personnel, 2 doctors and 4 nurses will be on the flight returning from China to provide medical assistance as required, including health screening of the passengers before, during, and at the conclusion of the flight. When the returning Canadians arrive in Trenton, they'll be provided accommodation at the Yukon Lodge, which is the Canadian Armed Forces base Trenton's newest accommodation. Trenton was chosen, as Mr. Haidu said, due to its ability to accommodate large numbers of people within a short timeline. We will make this day as comfortable as possible for the returning Canadians. And I want to assure all Canadian Armed Forces personnel and their families that their well-being is a priority and that we are taking all appropriate actions to protect their health based on expert medical advice. And I just want to state that I will continue to work with my colleagues to support their efforts to protect Canadians. Thank you.
On parle des questions, environ 20 minutes.
We have about 20 minutes for questions.
We have still microphones that are going in the room, so I'll be saying one media outlet, then the next one who's will be asking questions. On va commencer avec Le Devoir, ensuite ça va être Reuters.
Let's begin with Le Devoir.
And it's one question, one follow-up.
And then Reuters. One.
Si vous avez une question,
Peut-être pour Monsieur Champagne.
Good morning. I have a question for Minister Champagne. First question. When do you expect the flight to arrive and leave Wuhan? And the last number you gave us was 325 Canadians who wish to leave. Has that number changed? And can all of those people embark on the same plane? Will there be enough room for them all? Well, we have 304 Canadians who've asked for our assistance to return to Canada. 280 of them have Canadian passports. We have already chartered a plane, but of course, under the circumstances, you can understand that I did receive authorization over the weekend to charter a second flight in case more Canadians need to be repatriated. As for the flights, well, the manifest, as we speak, is being finalized. I can come back to you with the exact flight times, but I can tell you that given the most recent approvals received, we are still finalizing the flight manifests and authorizations. I can come back to you with more information once the flight is taken off to tell you where it's going. It will be going to Hanoi, where we have a team waiting to deal with them, and then we'll be able to enter Chinese airspace. We still do. We're still waiting for Chinese authorization to enter Wuhan airspace. So, is it a number? You're talking about hours then? Yes, it's hours until the flight is positioned in Hanoi. After which, we are still awaiting the final authorization by the Chinese government. Will there be room on this plane for the 280 people? You're saying that you may need a second flight, a second plane. What assurances do you have that adjustments will be made for families to stay together if there's a permanent resident or a child, for example? Well, as to the second aspect of your second question, we have received assurances by the Chinese authorities that family units would remain together. That is to say that all Canadian children will be able to be accompanied either by a Canadian or a permanent resident or even a Chinese citizen in order to accompany them back to Canada, if necessary. And yes, we did purchase an option for a second flight to repatriate further Canadians if necessary, if the first flight is not sufficient. Based on the consultations I've had with my counterparts in several other countries, of course, the numbers fluctuate. They fluctuate on a daily basis because some people choose to come back, some people choose to remain. And there is also a certain number of people who sometimes don't show up at the airport. So we're looking at all those numbers. But in the interest of Canadians, we have already secured, if required, a second plane. And we're having discussions with our allies in various countries. We're a few Canadians to remain behind, and we can't fit them into our plates. So everyone is coordinating their efforts to make sure consular services are being offered to all Canadians wishing to return.
No. It's not that way it works here. You'll have questions. Do you have a question?
Me?
Yeah.
Yeah.
Can someone give Harter the mic?
I didn't hear you say a word.
Hello. So, of the 280 with Canadian passports, can you tell us if all of them are compliant with with the requirements of the Chinese government? Because some of it's a bit complicated. Some have dual citizenship. They may not have entered China with their Canadian passport. Do you know exactly how many might be able to make it on that flight right now?
Well, like I said, this is a fluctuating number because people, the first thing we did, it was a three-stage process. Let's be very simple in that. The first thing you need to do in a situation like that, you need to assess the needs. This is already done, obviously. The second thing is obviously to charter the plane. And the third aspect of it is to secure the authorization and organize the ground logistics. To answer your question on the ground logistics, we will be contacting everyone starting this afternoon because it's about 1 a.m. Currently in Wuhan as we speak. We will be contacting Canadians throughout the afternoon as early as their morning to give them all the details, what they need to bring, what we need for the manifest. And like I said, we have a plane which is large, but should we miss a few seats, we have secured a second plane. We bought an option over the weekend to have a second plane ready to go. And alternatively, we're talking with a number of countries. As you know, there's a big international cooperation. If we were missing only a few seats, we might be able to cooperate. As you know, we have already repatriated Canadians on other airlines, on other I would say allies who brought Canadians in the UK, for example. So what I'm saying is that we have contingency plan for all situation, and we will be making sure we monitor that hour by hour.
Okay, thank you. Can I follow up with Dr. Tam? I have a question over that 14-day quarantine. I was reading about other testing for people who tested positive and were put in quarantine, and if they tested negative for 2 days in a row, then they were allowed to go home. Essentially, they were free from the virus. Is there a reason that they need to be held for 14 days, or is there a way that you could accelerate that? Is it a precaution that may be a bit too much?
So the 14-day period for having them at Trenton is a precautionary measure because the passengers would have come from an area with the most intense transmission of the virus in China. 14 days, of course, is the longest incubation period, if you like, during which someone might become sick. So right now, that is the plan. Of course, we have daily monitoring of the passengers to see what's happening with them, but also anyone who's been on that plane. So that is the plan at the moment.
Radio-Canada, ensuite Global.
Thank you, Radio-Canada. Good morning, Christian Noël, Radio-Canada. For a family that has a child with a Canadian mother and a father who's a permanent resident, can the permanent resident return to Canada, or must he remain in China, and who makes that decision? As I was saying, when I had my call with the Chinese Minister of Foreign Affairs, we insisted on the concept of preserving the family unit intact. That is Canada's position, and most of the countries in the world have the same position. What we've asked the Chinese authorities is to keep the family units together, and we have received confirmation from Chinese authorities that the family units will remain together. If there are children, yes, if there are children, because as you know, China, and this applies to all countries, whether that be Canada, US, or UK, has allowed foreign nationals to leave. That is to say, Canadian citizens who are traveling with a Canadian passport. But when there are children involved, what we've asked Chinese authorities for, since it's Canada's will and most of the international community is in agreement, that family units should remain together. That being said, we are also asking Chinese authorities to allow all Canadian nationals to leave. So that is something that's going to be they're taking it under advisement for the days to come. Since it seems slow to receive authorization to allow all Canadians to leave and to allow planes to enter Chinese airspace, do you think there's a link between that slow approvals process and tensions with China right now? I don't think it's appropriate to talk about slowness of approvals process, because just a few days ago we had 2 Canadians that morning who asked to be repatriated, and then it went from 27 to about 100. As I'm saying today, there are over 300 Canadians wishing to be repatriated. As soon as we made the decision to charter a plane and we received approvals, it took about the same number of days as for other countries. You have to understand that in the case of the United States, they had their own evacuations consulate with their own diplomatic processes. And I'm just giving you the overall perspective. The same holds true for the Japanese. The Japanese also had many factories with Japanese workers in them in China. So we adapted to this situation. As I said 7 days ago, we had 2 Canadians. It's now gone up to over 300 in just a few days. So I would say that, on the contrary, Chinese authorities and Vietnamese authorities have cooperated with us. At each step, the process has to be reviewed, and you've seen that recently the airspace between Vietnam and China is now closed, so we needed to do special dispensation at the presidential level to allow our plane to go from Hanoi to China and enter Chinese airspace. But I can tell you that our rapid deployment team and our national defense team, as well as our crews, all visas were obtained already. What we're now waiting for is the last permit to submit the flight manifest. That depends, from my understanding, is that flights arrive in Wuhan at night, and Chinese authorities have concerns. We're not the only country, of course, that wishes to repatriate its citizens. So there's material entering Wuhan as well. So I would say that Chinese authorities' cooperation is there, and we thank them because we're continuing to work with them to obtain that final authorization we need.
Mr. Champagne, just to pick up on that in
Mr.
English.
Champagne.
What do you say to critics who say the lack of being able to get into China right now is because we have had strained diplomatic relations with them?
I would not even suggest that. Quite to the opposite. You've heard my comments. The moment I've asked a call with the Chinese foreign minister, if my recollection was right, we got a call within hours to go through all the steps that we need. What I was saying in French before is that you have 3 aspects of that, 3 steps. The first one is to assess the needs, which we did. The second one is obviously to charter the plane, which we did. The third one is to organize the permits and authorization and the ground logistics. If you look at the moment, if I go back to the 27th, so a week ago, we had about 2 Canadians. It went to 100 towards the night that wanted repatriation, assisted repatriation. Now we're up to 300. So my point is that if you look at every nation, by the time you charter the plane and the time you get all the authorization, it's about the same amount of days. I would say that even if you add the complexity which we had, for example, over the weekend, whereas you have more flight and travel restriction, for example, Vietnam restricted its airspace for any flights that would go to and from China. So we had to get dispensation from the president to be able to stage in Vietnam and be able to fly. So the very last permit we need is obviously to land in Wuhan. There's a sequencing to that because planes, my understanding, can only land during the night. And there's also a sequencing of medical supply, which is getting into Wuhan. So I would say that if I look at the number of days for Canada compared to the other nations, considering that we didn't have a consulate to evacuate or significant manufacturing plants like, for example, the Japanese, our response is proportionate, and I would look at the number of days. It is pretty much in line with every other countries based on my discussions with my European allies.
Just for my follow-up, I kind of want to double barrel it to you and to Minister Haidu. Can you talk about the family unification and whether or not they have children? Will there be an issue in keeping people together if one, let's say, is a permanent resident, the other one is a Canadian citizen? And to Minister Haidu, I remember last week you had said that
even if a Canadian wants to come home, if they're presenting symptoms, if somebody gets to the airport is presenting symptoms, will they even be allowed to get on that Canadian plane?
So I can start with that, and the answer is no. Our understanding from the Chinese authorities is that no one who is presenting symptoms will be able to fly. This is actually part of China's extensive effort to contain the spread of disease, and so they've been resolute on this with all countries, and so I think we have to be prepared to understand that that's not going to be a flexible point for discussion. The reality is that obviously we're working within their jurisdiction, and we won't, I know that Minister Champagne has been able to get some concessions around family unification, but I don't anticipate we'll be able to get the Chinese to concede on that point.
Presse canadienne, après ça, ça va être CBC.
Canadian Press and then CBC.
Sorry, he's the boss now, so I'm happy to...
I was waiting for him to answer that.
Okay, well, I'm happy to answer that, obviously. What I said is that what we have asked the Chinese, and this is in line with the international community, is to preserve family unities, is to not to separate. That applies, obviously, when you have children under 18, in the sense that if you had a child which would be Canadian, but you would have a primary caregiver which would be a permanent resident or a Chinese national, what we have petitioned is that, obviously, to repatriate, we have asked the Chinese authority to allow the primary caregivers, whether they're Canadian citizen, permanent resident, or Chinese national, to be able to fly with that child in Canada. We receive assurance that China will follow suit on that. I would subscribe to what Minister Hajdu has said with respect to other nationals, which is not in the case of family unity. The position of China has remained the same for all countries, which is they would only allow foreigners to be repatriated in their countries.
And I would just add, in terms of someone who is symptomatic and flying, that could obviously present challenges for the other passengers as well as for the staff that are working, depending on the severity of their illness. So, even from a medical perspective, it probably wouldn't be wise for someone to be traveling if they are suspected of having the virus.
Good afternoon. Two simple questions for the public health officials who were here today. Last week, you asked people to remain calm. Your provincial counterparts have done the same. Do you believe that those calls to remain calm have worked? The situation hasn't changed for Canada. We have very good healthcare system, public health systems that are very well integrated. The risk for Canada remains quite low. Yes, but you said that Canadians should not have irrational fears. You asked Canadians to remain calm. I'm wondering if your calls to remain calm worked, and I wondered as well. You said about 300 Canadians will be repatriated and returning to our country. What can you tell the population to calm their fears now? Well, there are two aspects to your question. Here in Canada, so far, we've only had 4 cases. The virus hasn't moved on to any other people so far in Canada. For Canadians that are currently in China, I think it's daily life is very difficult right now. The schools are closed. It's hard to find healthcare services, and public transit has ceased as well. Given all of that, I think many Canadians can return to Canada. And for us, it's important that we offer services to repatriate them here.
I mean, the majority, well, actually, we have no indication that any of the Canadians asking for help are ill right now. Now, that might change, and the screenings are there to assess that. But why they are asking to leave Wuhan is that life has become exceedingly difficult in a city that is under such extreme quarantine. Supplies are running low. Many schools are shut. Many people are maybe students or employed there that are not able to carry on in their everyday lives. So the situation in terms of daily life has become extremely difficult, and there's no line of sight for the Canadians that are there in terms of when that might change. And so I think that's a very important thing to remember.
On avait CBC, ensuite on va aller à Winnipeg.
CBC, and then Winnipeg Free Press.
Hi, Minister Champagne. Just some clarification on the permanent resident issue. You've asked for family units to be allowed to stay together, but it seems the trigger for it to be considered a family unit is the presence of a child.
Indeed.
So would permanent residents with not traveling with a child be allowed to leave, or would permanent residents not traveling with a Canadian citizen but may be married to a Canadian citizen who's in Canada, would they be allowed to leave?
So let me be very, very clear. So the position of the Chinese authority as we speak is that only foreign nationals, meaning in their case of Canada, Canadian citizens, which would be allowed, and as Minister Hajdu said rightly, those who would be undergoing before even they board medical testing, so those who are asymptomatic would be allowed on the plane. That position of the Chinese authority is the same with respect to every other nation that I'm aware of. So in the sense that they've allowed, and Minister Hajdu explained the reasons for that, that they would allow us to repatriate foreign nationals. We obviously, in my discussion with Minister Wang Yi, State Councillor Wang Yi, which is the Foreign Minister of China, I've asked him, like other nations, to consider whether we could also repatriate permanent residents. The concession or the position that has been taken by China is to preserve family unity. So when there's a child, if the primary caregiver is a permanent resident, they would allow that child, which is Canadian, with the primary caregiver to come. But the position that China has been taking is the same, but I would say that we will continue, obviously, to provide consular assistance to every Canadian and permanent resident, and we'll continue to ask for us to be able to repatriate every Canadian and permanent resident.
So permanent residents who aren't a primary caregiver or they're on their own, they don't get to get on this plane and that's China's decision, not Canada. I just want to clarify.
Exactly. Okay. And it's the decision of China with respect to every other country. So it's not country specific. It's just the position of China in their assessment to prevent the spread of the virus.
So as a follow-up, what's the maximum capacity for the plane you have chartered at this point in time? Like how many people can fit on that plane? And how quickly would you trigger the option of the second plane? Would these happen at the same time, or would this be a secondary process with a lag?
Well, we have the option for the second plane because, as you know, the number are fluctuating by the day. I would say they're fluctuating by the hour. So we're managing that. We are also learning from best practice that there's a number of no-show. There's people who change their mind. So I would say the capacity of the plane now is a big plane. I won't get into all the numbers because they change too often. But what I will do is that once the plane is in position on its way to Hanoi, and when the plane departs from China, we'll give you all the updates, and we will give you also the exact number of people on the manifest. I just want to make sure that the manifest is completed, and we're doing that as we speak, because we need, as you would appreciate, we need to provide that to the Chinese authority quite in advance, because from the manifest, so that Canadians who watch us understand, that manifest needs to go down to the particular police or security officer in front of every building to say that that person with that license plate, with that driver in that car or that bus is allowed to move across the number of checkpoints that are existing. To give a sense of perspective to Canadian, Wuhan is a city of 11 million people. So there's more people in Wuhan than you find in New York or, for example, London. So when you have a city like that in lockdown, we need to make sure that not only we get our plane on the ground, that's why we send our emergency response team in Wuhan, because they need to assist Canadians to get the manifest, get all the documents that the Chinese authorities would want, and distribute that to all the chain of command up to, obviously, the airport so that people can make their way to the airport.
Donc, on va aller à Winnipeg Free Press, ensuite ça va être National Post. Il y a encore beaucoup de monde sur la liste.
Winnipeg Free Press, the National Post, there are still quite a few people on the list.
Ministers, I'd like to know the province of residence of these evacuees. If you could list how many per province, that'd be great. And if not, could you at least rule out which provinces aren't expecting anyone to come after the quarantine?
I think that's an evolving assessment. In fact, some people may not have a province of residence. As I mentioned earlier, there may be Canadian citizens in Wuhan that haven't lived in Canada for some time, given their student status or potentially their employee status. So I know that that is the work that Minister Champagne's team is doing right now. So it's difficult to say right now which provinces are ruled out.
Dr. Tam, I was wondering if you could give an update on the number of tests of patients whose samples have been tested at the National Microbiology Lab, specifically the positive, the negative, and what is the term for those? Are they pending? I'm not sure what the precise terminology is. Please be as precise as you can with the numbers.
So I think it's important to focus on the important numbers. I mean, right now we've had 126 persons or patients who have been asked to be tested at the confirmatory laboratory at the National Microbiology Lab, so 126, of which only 4 have tested positive. So that's where we're at now.
And pending?
All I can say is the majority of tests are already being done, and these are the only 4 positives.
You said 58 were negative before. Why not give an update?
Okay, so because every minute of the day that actually changes. So the lab is probably processing everything right now. Or as of yesterday, say, I know that 119 have already tested negative, 4 are positive. But just to say that this is not a number that it really does change all the time.
National Post and then the Star.
Mr. Hajdu, last week you talked a lot about the value of people isolating themselves when they returned from China, especially if they weren't showing symptoms. I'm wondering why, in the case of this plane, you decided to have them isolated at Trenton rather than have them isolated at home.
So I think what we need to remember is these folks are in the city of Wuhan, and that is the epicenter of the epidemic. In fact, they are in a city that is not allowing any transportation out whatsoever, and other passengers that are arriving from China are arriving from places that are not under quarantine. So they are having, quite a bit more mobility in terms of their transportation, and less likely to be in regions where there is a significant outbreak. And so I think when we're talking about, as Dr. Tam said, the quarantine of these particular individuals, it's out of a sense of precaution, given the fact that they've been restricted from travel and in this epicenter of where we know the epidemic is the most severe.
And just quickly, Mr. Champagne, when do you expect to know when the plane will land?
Well, I will tell you as soon. I'm in touch with the CEO of the logistics company, so I will tell Canadians as soon as I know that it will up on its way to Hanoi, and we'll say that to Canadian. And like I said, it's going to be pre-positioned in Hanoi because the last permit we get, if I base that on experience with other nations, you get that within hours of departure. So our team will be pre-positioned with DND personnel, flight crew on board to be able to immediately deploy to Wuhan, and we'll be communicating that, I was saying, to Canadians because it's nighttime, so in a few hours in the morning, they'll get the details to make sure we have all the final details on the manifest, which we need to provide, as you would expect, to the Chinese authority a number of hours in advance of our deployment in Wuhan.
J'ai Star and then Canadian Press.
When the plane gets to Wuhan, if there's more Canadians who are cleared to leave than the plane can hold, how will you decide which ones to take?
So we have an evacuation protocol which is well in place. That applies to other emergency situation. If there was a case of hurricane where we need to bring back people or other, we obviously go with logic, elderly, children, people who might be sick. Obviously, we go in an order, pregnant women, for example. So we'll follow the same protocol that is well established. And I want to reassure everyone watching, the plane is big. The numbers are fluctuating. We have a second plane if we need to. And in addition to that, not only we have a second plane ready to go, but we also have discussions with other allies to say whether, if we need just a few seats, what's the best options, obviously, to bring back these Canadians back home.
And just maybe this is a question for Dr. Tam, but other countries, as I understand it, have imposed travel restrictions on people going into their countries from China. As far as I know, Canada hasn't done the same thing. Can you explain if that's correct and why we haven't?
Obviously, every country is taking has the responsibility to taking their own decisions. Right now, we provide travel advice, which is avoid all travel to the province of Hubei, and and also avoid non-essential travel to the rest of China. So that is our current position.
I guess just my question is why though? Why haven't we gone further than that like other countries have?
In terms of, I don't think that is my question to answer. You mean preventing people from coming in?
So firstly, we're working with the best evidence that we have, and the World Health Organization has been very helpful in providing advice to countries in terms of how to best help China contain the spread. We actually are doing, as you know, a fairly extensive level of screening, including additional questions for people that to identify who's traveling from Hubei at the 3 international airports, as well as providing public health support to the CBSA officers who are, talking to people who are coming from China, but more particularly from Hubei, providing written information in 3 official languages to people to determine what to do should, in fact, they develop any symptoms after arriving in Canada. This has been working incredibly well. As you know, we've been able to very rapidly respond to any particular identified cases, and people have known what to do to help us to do that. So at this point, there isn't the evidence to support that closing all the borders is necessarily the right way to go. Certainly, we feel that, we know actually that the evidence suggests quite actually the opposite, that in fact by closing down the borders it's much harder to detect where someone is coming from, that this way this open and honest transaction actually allows for much more detailed screening for people coming from Hubei rather than trying to figure out who's coming through which country and at what time frame. And so we're very confident that this process is working. We will obviously assess the process along the way, and certainly the collaboration of the provinces and territories and the municipal level of government has been incredibly helpful. The things that we've learned from SARS, as you know, I've spoken about this before, but we've had a lot of lessons learned through the SARS experience and 17 years of collaboration, including the creation of the Canada Public Health Agency and the position of a Chief Medical Officer of Health that helps for that rapid coordination in cases like this, and that's certainly helping us ensure the health and safety of Canadians.
Canadian Press, en presse, c'est CTV.
Yeah, I just wanted to, pardon me. I wanted to ask about the, once the passengers are here and quarantined at CFB Trenton, if someone should fall ill within a few days of arriving, does that then extend the quarantine period 14 days, another 14 days? You see what I'm saying? Or is it possible that they could all wind up there for much longer than 14 days?
So that's an excellent question. Part of the reasons why we're offering social support is they will also be isolated from one another. So the isolation isn't just for the group, it's actually individuals who are isolated from one another. So if one person falls ill, that won't necessitate the start of another quarantine for all of the passengers. It means that that person will be identified and then isolated within a hospital setting to treat them and help them recover.
Okay. And Dr. Tam, I wonder if you could answer this question. The minister talked about it last week, but I'd appreciate your view on the U.S. declaring last week a health emergency. Do you think that is necessary, or is that getting alarmist?
Do you want me to start? I think from our perspective, obviously, other jurisdictions will take decisions based on a variety of factors, but from a Canadian perspective, we feel that we have the processes in place and that the system is working. So this is not, in fact, a public health emergency, given the numbers that we've seen and given the processes that are working very efficiently. I'll turn it to Dr. Tam for a few words.
Yes, I think the U.S. process is actually very different to ours, and that right now we have all the necessary processes, authorities in place to affect our response. So we do not need any further authorities or powers in order to already execute that coordinated response that we have.
La politics après.
Hi, I'm not exactly sure who this question is for, but you talked about Canadians who are sick not being able to get on the plane, anybody who shows symptoms. I wonder, one, if you're aware of any Canadians or permanent residents who are in Wuhan or in China who are being cared for by the Chinese authorities who might be showing some type of symptoms of the virus, and also what type of measures will be there to help Canadians who do show symptoms and are not on the plane despite asking for assistance getting out of Wuhan.
So, based on the latest information that I have, no Canadians have any symptoms of the virus. So that's the latest information that has been provided. Should there be one, we would obviously, the reason why we deployed what we call our standing rapid deployment team in Wuhan is obviously to continue to provide consular services to these people. Like we would do in any type of emergency, our consular officials would be there to continue to assist Canadians who would remain in Wuhan, because as you know, if you compare to the number of people who have registered with us, there's about more than 500 in Hubei provinces. So what you see is that a number of them have decided to stay, which is their choice. So we will continue to provide consular services, and that would be exactly the same, obviously, if someone was to fall ill, and we would assist them as we normally assist Canadians abroad.
Okay, so this is a two-part question. Minister Champagne, I'm hoping that you can elaborate on exactly what these types of consular services are. And my second question is for Dr. Tam. There are obviously more cases every day, both in terms of new cases being confirmed in China as well as more deaths. I'm wondering if you're seeing any signs through the media or through the information that you have with the WHO that the containment measures that China is putting in place seem to be working, and if you see any hope that perhaps containment is in the near future.
Why don't you go first, Dr. Tam?
So what we're seeing is quite an extraordinary undertaking by Chinese authorities in trying to put into place these containment measures. We have never seen this large-scale quarantine measures in modern public health history. So the world, of course, is wanting to know if it does work. So the effect of the containment measures in Wuhan, for example, I think it started on January 23rd. So this is quite a critical period for us to see if some of those measures are managed to interrupt spread. So I think we still have to wait a little bit of time. The other aspect is that even if they work, you're going to still see increase in cases for a period of time before I think the epidemic curve is necessarily going to come down. With incubation periods, the periods of time people are reported, etc. So I think we're watching, and the World Health Organization is watching that very closely. This is actually quite an important period of time. But I want to certainly stress that the response is going to go on for months. What if it doesn't work, for example, the world's public health authorities are looking at, well, China is going to teach us a lot about how these measures may or may not work. So I think from that perspective, again, support to China and what they're doing, because they're going to let us know quite a bit about the effectiveness of those measures. But right now, the whole world is still in this containment mode. The World Health Organization declared this public health emergency of international concern, so that not just China is responding, but all the other countries are getting ready to interrupt any importations and chain of spread. So that is the current stance that we have. We're going to all give it a really good go, and of course take it really seriously to prepare for any other eventual scenario.
To the second part of your question, we would accompany them and make sure that they receive assistance from the local health authority like we would normally do, and provide them being in constant contact. And I'm happy for those Canadians who are watching. I really encourage everyone to obviously register on the Global Affairs website. Be on the look also for information that's going to be coming within hours, so that they can receive all the necessary details. We're talking to them almost on a daily basis. So we would be providing them assistance, not only for those who are going to board the flight, but those who remain obviously in Wuhan and Hubei province.
Il nous reste un peu moins de 5 minutes. We have less than 5 minutes.
We have less than 5 minutes left.
We can just try to keep it short. iPolitics, après ça, Hill Times.
All right. Just about this whole process with the evacuated, is there any part of the process where they will be responsible for paying for whatever it may be, and alternatively, is there any chance that they would be compensated for undergoing this process itself?
Well, let me be clear to Canadians who are watching. Our first and foremost priority has been to help people. There are people who are in a situation, I think Dr. Tan said it, unprecedented. You have a city bigger in terms of population in London or New York, which is currently on lockdown. You would appreciate that all the time and effort that we have dedicated is to assist these people. That's our absolute priority. Now, when it comes to cost, we will assume the cost for repatriation from Wuhan to Trenton. But again, let me say, and I'm sure Minister Hajdu would want to add to that, first and foremost is about helping people. We, as a country, always stand up for Canadians abroad, and certainly in times of needs like that, which are quite unprecedented. Do you want to add anything, Mr.
Well, I think you've said it very well, Minister Champagne. I think this is what Canadians do, is we help each other. And we've got, 300 Canadians stuck in a quarantine city where life is becoming incredibly difficult, if not almost impossible in some situations. And they've asked their government for assistance. And that's what we do when Canadians are in trouble. In terms of compensation for the experience, I think Canadians will be very grateful to come home. I think it's been a grueling period of time for them, and I think that my sense is that Canadians will be very happy to get back on Canadian soil.
And I imagine this would be courtesy of the provinces, but how is the federal government being informed about what's going on at the practice level? What's informing really the information that you're receiving about what's happening here in Canada in terms of this virus?
Well, I'll turn to Dr. Tam in a second, but in fact, that's, I think, one of the things where Canada has been noted and praised by the World Health Organization in terms of our collaboration and our very integrated systems. So as the Chief Public Health Officer of Ontario, Dr. Tam has the ability and does regularly to convene her provincial territorial partners, and that information flows down right to the local level with technical advice. And so all of that collaboration, including some regulatory requirements to report cases, for example, to the federal government, has allowed for that very rapid response that you've seen in terms of case identification and treatment. Maybe you'd like to say a few more words, Dr. Tam?
Yes, so in the last number of years after SARS, we created the necessary structures between the federal government and the province and all the provinces and territories, so that the moment I heard about the cases of pneumonia in Wuhan, and even before we identified which virus, we already had the whole system alerted, and the expectation that provinces and territories will collaborate and report cases at the central level. Plus, we have also the National Microbiology Laboratory that actually developed the necessary tests. So in fact, all cases and all these tests are coming to our lab as well for confirmation. So we will always know if we have a case in Canada. We also collaborate to develop the necessary guidance that it takes to look at how we best manage the case, but also contact tracing and how to go about that as well. That is based on collaboration and consensus. I think that, the other really important aspect is that we've been planning for these scenarios all along. And we have in place a federal, provincial, territorial response plan just for these biological or infectious disease events. We have a pandemic preparedness plan guidance so that every component has already been mapped out for that sort of influenza, but essentially applicable to respiratory virus scenarios. So we are essentially just taking all of those many bits of plans and preparedness and executing a lot of the things that we've been practicing for, essentially. So I think it's functioned very well, as has been seen by how these initial cases have been managed.
Is there any update as to whether asymptomatic people can be infected?
So we're aware of a number of currently rare case reports of asymptomatic persons that have a positive identification of the virus through genetic testing, really a swab. the WHO is actually pursuing those reports because you need to verify them and determine if they're truly asymptomatic or not. That's one thing. Two is that even if you detect some viral genetic material on someone, doesn't necessarily mean they're infected. They could be carrying some pieces of the viral genetic material without actually getting an infection. That's a sort of carrier state. The third aspect that we're trying to look at is, well, do these people even spread the infection even if they're carrying or they're asymptomatic? What we know about these viruses is that I think while this bits of the scientific jigsaw is being put together, we know that in general it's coughing up droplets. So if someone isn't sick and isn't symptomatic, the virus is maybe deep inside their lung, they're not going to be able to transmit that very readily. Fourthly is that are these events rare? We believe that they're likely rare and they don't contribute to the propagation of this epidemic right now. But there's still a lot that we need to learn, and every day we're learning a bit more, so we'll be adjusting as we go.
And as a follow-up, is there any update as to how close we are to an antiviral medication and how quickly Canada would have access to that medication?
So Canada is part of the global research discussion and are supporting some of the international collaborations. We're aware that the World Health Organization has something called the Research and Development Blueprint for this coronavirus. So a lot of that stuff is going on. I do know that there are a whole host of antivirals that are being looked at right now. We don't have a specific treatment, but the whole world is examining the existing antivirals. I do know that the ambition is also to look at clinical trials, of course, in countries that have the most cases, in this case, China. So right now there is no specific treatment, but I think that with some good research collaboration, we're going to get some answers. The vaccine, on the other hand, there's quite a number of candidates being examined, but vaccine development takes some time. They need many phases of clinical trials. So even if you have a candidate, it's going to take quite a number of months for that to go through the trials because we want it to be safe and we want it to be effective. So the closest estimate that I've heard is probably in a year now. When the global research community is getting together, you would want to see if faster things can happen, but the reality, I think that's a reality check, is that a vaccine is likely not going to be available for a year.
If I could just add on the research piece, in Budget 2018, we actually funded in the area of about $280 million for rapid research through the CIHR and the Tri Research Council. And so we'll be very quickly in the next couple of weeks, there'll be a call for proposals for rapid research on the coronavirus. So we'll be able to add some Canadian contribution through that.
Okay, on me fait dire que c'est fini, là, mais I just want to go one.
We're finished now.
Yes, thank you. Merci.
Thank you.
Andrea Gunn from the Chronicle Herald. Nous avons une question de Andrea Gunn de the Chronicle.
We have a question from Andrea Harkin from the Chronicle Herald. Please go ahead. The line is open.
I believe my question was asked. I was trying to see if there's any, I think Dylan Robinson asked it, but trying to get a breakdown of the number of people that are bound for each of the provinces coming back from China, trying to do a regional piece. So I guess you're not releasing those numbers, though.
We do have some indication of some people from certain provinces, but we don't have a full indication. And I think, as Minister Champagne pointed out, those numbers change hour to hour. We'll certainly be transparent with that information as we get a better sense.
As I said, we're still working out the manifest as we speak. I'm looking at the time, and I know we're finalizing it. So once this is done, when we know how many people have boarded, like Minister Hajdu would say, we'd rather give certainty on numbers when we have final numbers.
Merci beaucoup.
Thank you.
Merci tout le monde.
Thank you.
Thank you, everyone.
Merci à vous.
And you have been watching a news conference in Ottawa by ministers as well as public health officials giving us an update on the coronavirus outbreak and more specifically plans to repatriate the hundreds of Canadians who have requested, a bit less, around 300 or so, who have requested to come back to Canada. The CBC's Janice McGregor is on the story live from Ottawa. So Janice, there was a lot of information there, but what are the key pieces of information we learned?
Yeah, a number of things. I'll try and go over them quickly. First, 280. That is an important number. That is